Good day, ma'am and sir. I am Kaysilan Pelago, a student nurse from J. Sirleaf State College, Pagadian. Prior to perform the procedure, introduce yourself and verify the client identity. Explain to the client what you're going to do and why it is necessary. So good day, ma'am. I am Kaysilan Pelago, your nurse for today. May I know your name?
My name is Jocelyn Lumokso.
So this morning I will assess your eyes. I am going to assess your eyes to inspect any abnormalities as well as symptoms of any possible diseases. Is that okay with you, ma'am?
Okay.
In assessing your client or patient, perform hand hygiene to avoid the transmission of infection. Next, we will provide for the client privacy. Inquire if the client has any history of the following: family history of diabetes, hypertension, any disease, injury, surgery, current use of eye medication, uses of eyeglasses, current symptoms of eye problems such as changes in visual acuity, vision, tearing, spots, photophobia, itching, or pain. So ma'am, does your family has any past history of having diabetes?
None.
How about hypertension?
None.
Do you have any eye disease?
None.
Any past injury?
None.
How about surgery, ma'am?
None.
Do you have a medication for your eye that you are currently taking?
None.
Are you using eyeglasses for your vision?
No.
Are you experiencing current symptoms of eye problems such as blurred vision?
None.
Inspect the eyelids and eyelashes. Note the width and position of palpebral fissures. Assess ability of eyelids to close. Note the position of the eyelids in comparison with the eyeballs, such as turning, color, swelling, lesions, or discharge. Observe the position and alignment of the eyeball in the eye socket. So ma'am, can you close and open your eyes? Inspect the bulbar conjunctiva and sclera. Have the client keep the head straight while looking from side to side, then up toward the ceiling. So ma'am, can you keep your head straight? Can you look to your right, to your left, then up toward the ceiling? Inspect palpebral conjunctiva. Put on gloves for this assessment procedure. First, inspect the palpebral conjunctiva of the lower orbital rim and gently pulling down to expose the palpebral conjunctiva. Avoid putting pressure on the eye. As the client look up as you observe the exposed areas. Ma'am, can you look up above the ceiling? Okay, ma'am. Down. Inspect the lacrimal apparatus. Assess the areas over the lacrimal glands and puncta. Palpate the lacrimal apparatus. Inspect the cornea and lens. Shine from the side of the eye for an oblique view. Inspect the iris and pupil. Inspect shape and color of iris and size and shape of pupil. Test pupillary reaction to light. Test for direct response by darkening the room and asking the client to focus on a distant object. To test the direct pupil reaction, shine a light obliquely into the pupil and asking the client to focus on an object in a distance. Assess consensual response at the same time as direct response by shining a light obliquely into one eye and observing the pupillary reaction in the opposite eye. Test accommodation of pupils. Accommodation occurs when the client moves his or her focus of vision from a distant point to a near object, causing the pupils to constrict. Hold your finger or a pencil moves her focus of vision from about 12 inches from the client. Ask your client to focus on your finger or pencil and to remain focused as you move it closer toward the eyes. So ma'am, kindly focus your eyes in this object. 1, 2. Perform corneal light reflex test. Hold the pen light approximately 12 inches from the client face. Shine the light toward the bridge of the nose while the client stares straight ahead. Perform the cover test. Ask the client to stare straight ahead and focus on a distant object. Cover one of the client's eyes with a pack card. As you cover the eye, observe the uncovered eye for movement. Remove the opaque card and observe the previously covered eye for any movement. Repeat the test on the opposite eye. Assess 6 ocular movements to determine eye alignment and coordination. Stand directly in front of the client and hold the pen light at a comfortable position, such as 30 centimeters in the front of the client. Ask the client to hold the head in fixed position facing you and to follow the movement of the pen light. Move the pen light in a slow, orderly manner through the 6 cardinal fields in gaze. That is from the center of the eye along the lines of the arrows in and back to the center. Stop the movement of the pen light periodically so that nystagmus can be detected. Assess peripheral visual fields to determine function of the retina and neuronal visual pathways to the brain. And second, optic cranial nerve. Have the client sit directly facing you at the distance of 60 to 90 centimeters. Ask the client to cover the right eye with a card and look directly at your nose. Cover or close your eye directly opposite the client's record eye and look directly at the client's nose. Like pencil or pen light in your fingers. Extend your arm and move the object into the visual field from various points in the periphery. The object should be at equal distance from the client and periphery. The object should be at equal distance from the client and yourself. Ask the client to tell you when the moving object spotted. The temporal field of the left eye, extend and move your right arm in from the client's right periphery. To test the upward field of the left eye, extend and move the right arm down from the upward periphery. To test the downward field of the left eye, extend and move the right arm up from the lower periphery. To test the nasal field of the left eye, extend and move your left arm from the periphery. Repeat the above steps for the right eye, reversing the process. Document findings in the client record using printed or electronic checklist supplemented by narrative notes when appropriate. Thank you so much for your time, ma'am. I hope you have a good day. Goodbye now.